Welcome to Straight Outta Health IT. Getting into health tech is rough, but here's an unfiltered dialogue of healthcare leaders and influencers covering a wide variety of issues affecting healthcare and the health tech industry. And now your host, Christopher Kunney.
Hello, everyone. This is Christopher Kunney, and welcome back to another episode of Straight Outta Health IT. Thank you so much for tuning in and listening to this week's podcast episode. Today, we're going across the pond, and we're going to talk to some folks or an individual from Italy. I'm going to explore the challenges and opportunities of the European health system, and specifically the technology ecosystem in Europe, and more specifically within Italy. And so in this dynamic landscape of healthcare technology, the European health technology ecosystem really stands at the forefront, presenting a unique set of challenges and opportunities, from regulatory considerations to intricacies in interoperability, dictated by the balance of data privacy and security, and collaborative efforts on ongoing innovation. The European health technology sector is really a tapestry woven with complexities. Moreover, the impact of the external factors, most notably things like the COVID-19 pandemic, has further shaped the trajectory of this ecosystem. And so today we're going to talk to an individual who has a unique perspective on what's happening in that market and specifically in her own community. And I'm so excited today to introduce you to Miss Giorgia Pezzotta. And if I mispronounced that, please correct me again.
Yes, it's okay.
Okay.
Thanks a lot for your invitation. I'm very happy to be with you today.
Thank you. So let me share a little bit about Giorgia. She is a healthcare innovation engineer with a strong entrepreneurial mindset and experience in healthcare and healthcare sector, spanning scale-ups to consulting and research. She's very committed to driving change, fostering strategic innovation, and promoting social impact. Her mission is to leverage innovation and technology to enhance people's health and healthcare management while delivering a better future for society as a whole. She's been recognized amongst the 100 under 35 young talents by Financial Times to innovate the future of the Italian entrepreneurship worldwide. She's also been selected for the Youth Talent Path program by IESE Business School and has been pre-admitted to their MBA program with a merit-based scholarship. Congratulations. She currently serves as a strategy and marketing associate aimed to scale Doctolib Siilo, the medical communication app for healthcare professionals in Italy. Previously, she was a project manager on the Italian hospital launch for Doctolib, the first e-health services in Europe, and one of the fastest growing healthcare tech companies as well. Previously, Giorgia served as a healthcare consultant for KPMG Advisory, SPA, and she actually holds 2 degrees in engineering and a master's degree focused on innovation strategies to tackle challenges in healthcare and the health sectors. And she has a bachelor's degree focused in biomedical technology. Wow, what a great person to have on the show today to talk about what's happening in the European market and specifically in the Italian market around healthcare technology. So welcome, Giorgia. Thank you for joining the program today.
Thank you so much. I'm very happy. Thanks.
Giorgia, one of the things I like to ask my guests is, I read your bio and you have a very impressive background, but that's just one part of Giorgia's story. I want you to fill in the blanks for our listeners and share with them a little bit about your professional journey. So if you wouldn't mind, tell us your story.
Yeah, actually, people think it is the easiest question, but probably is the hardest one.
Yes.
And basically, I decided to invest my career in the healthcare sector because I have strong drivers that have made me do this choice. First of all, I have different family members who suffer from chronic diseases. And that's why after my college, I decided to invest in my university studies in this direction. So with a focus on chronic disease management engineering course during my journey. Then I also live strongly the pandemic period because my small village where my family comes from and where I was actually in 2020 was hit with a greater than 10 times the norm, the death in 1 month. So very high level of death. And it was very hard that period because nobody knows what the things were going. And actually the third things was that during my adolescence, I lost over 20 kilos. And that actually was a personal transformation because it makes me understand the importance of mind-body connection, how it's important to make healthy habits in our day-to-day. And all these thoughts along my personal journey make me to invest in this sector.
No, that's great. Well, first of all, my condolences on the loss of any friends and family members during that period of time. I do remember distinctly when the pandemic hit, how much of an impact it had, specifically in Europe and more specifically in Italy as well, too. I remember the number of people who were being impacted by that.
Actually, I was lucky because nobody of my family except one very old parent. But in general, there were a lot of family also of my friends that suffer a lot. Yeah.
Yeah, absolutely. Again, thank you so much for coming on and sharing that and sharing your story and now helping to make a difference in what's happening within the healthcare technology landscape. There's a host of challenges, and your challenges, I'm sure, are probably no more different than the challenges we're having here in the US. So I'd love to explore those as well. Some of the primary challenges within that marketplace, your European health technology ecosystem, is navigating, like here in the US, an intricate web of regulatory compliance issues, whether it's the European Union boasting regulatory frameworks such as medical device regulations or vitro diagnostic regulations. These regulations obviously are there to try to ensure the safety and efficacy of these technologies, and this can be a very daunting task and challenge for many companies, especially startups and emerging technology companies. So I'm interested in hearing from your perspective, being a part of a company that is launching innovation in the space. What were some of the challenges your company experienced, and what are some of the challenges that you see other companies deal with as they try to navigate this regulatory and compliance landscape in Europe? And what are some of the regulatory compliance you're seeing that are starting to emerge now post-COVID as well?
Yeah, actually, I think we have different type of challenges. Probably from my perspective, the healthcare sector is the most complex one, but probably people in others can say the same for them. Yeah. But I can mention to you some that from my point of view are the most challenging, that are for sure the lack of digital literacy. Because, for example, in Italy, we have a very huge part of a population that is over 60 years old, for example, but is not so much something related to specifically the age, but it's something related to the culture. So, many people are not adept to use technology, especially in the healthcare space. So I'm talking about doctors and the healthcare professionals in the field. So one of the big challenges from my perspective is the lack of education and digital literacy. Another one, it is the high level of bureaucracy to bring digital technology in the systems. So this very long process and bureaucracy actually make a lot of states in Europe always a step back compared to others, for example, that are very at the far front. For example, I'm talking about North Europe, like Germany or Poland or many other important countries that are very far front of innovation. And another that, as you mentioned before, that is all the fragmentation of regulation from one side, but from the other, the problem of fragmentation of healthcare systems. So we have data silos and different healthcare systems. For example, in Italy, we have 20 regions, and each region is its own system,
Oh, really?
its own regulation. So when something is managed locally and not nationally or at a higher level, is difficult. But we can talk later maybe also to the innovation that are starting both at European level but also at national level in my country, so that are launching soon. So probably already next year, and in a couple of years, we will see consistent steps in this term.
Exactly. No, I think to your point, I think we experience some very similar things here in the U.S. It's still a very highly bureaucratic system. Our laws don't always keep up with the changes and the innovation that's happening in the marketplace to help to better manage and regulate those innovations that are happening. You look at things like, for example, AI, generative AI, and the promise that it has in healthcare, but yet we're still challenged with how our government is going to regulate and mandate the efficacy of the use of AI here in the U.S. as well. And although we don't have, quote unquote, the number of regions domestically here in the U.S., we still have a pretty fragmented system in that each state itself has its own laws and rules and regulations that can create challenges around the use of technology, specifically interoperability and patient privacy concerns that make it a challenge sometimes to be able to take the full advantage of technologies across a broader healthcare ecosystem. And so I see some correlation between what's happening there in Italy and some of the challenges we also experience here in the US. I can imagine that same challenge exists with things like interoperability and integration and sharing of patient data. I'm curious from your perspective as where is Italy in its adoption of electronic health records, and where is it in then the interoperability, the ability to share patient information across those broader geographic regions?
Yeah, I think that there are two important initiatives that need to be mentioned here at European level. The launch of European Health Data Space. So they are preparing, it is a very strong strategic initiative to create the sharing of health data across European countries to foster innovation, research, exchange of data and knowledge. So it is something that started in 2022, and now in this year and by the end of 2025, we will see actually the fruits of these big initiatives. And then from Italian perspective, we have it is FSE, that is the Italian Electronic Health Records. That is in Italian Fascicolo Sanitario Elettronico 2.0. That should be a way to make all the Italian citizens to access to their health data and manage it independently from the region that they are from, because it is a way to connect all the regional systems at a national level. Sure. And this can boost patient empowerment because patients can manage their health data information and also other things related to health services easily, and also making sure that improved standards and privacy security in terms of data sharing.
No, that's great. I think it sounds like to some degree, you guys may be even further along with creating kind of a national standard around the sharing of patient information than we are here in the United States. And correct me if I'm wrong, but it sounds like each of those regions has its own kind of unique electronic health record system, but then you're putting over that kind of a government platform that allows you to then exchange data between.
Yeah, let me say a platform that has a layer at national level.
Right.
And then we have a layer at regional level. Mm-hmm. But this higher layer is a national level and is able to connect each region.
Yes, yeah, you guys definitely are a lot further ahead than we are here in the US. We're still struggling with creating a national standard for exchanging data between the different systems. We have national standards around APIs and things like FHIR, for example, but an actual platform itself that is going to allow that exchanging of patient information amongst these disparate systems is we still have a long way to go here in the United States to get to that place. So it's interesting to see that you guys are much further along in that space. You had mentioned something about, again, that infrastructure being in place to support the privacy and security of patient data. I'm curious, here in the United States, we are, being targeted daily. You hear about health systems that are getting breached through ransomware and cybersecurity attacks that are impacting patient care. I'm curious, are you guys seeing the same thing happen in Europe and specifically in Italy? The
Actually, yeah, I know a couple of Italian examples that happen like this here
right.
of data breach inside hospitals.
Mhm.
So patient data that becomes public. I think it is the worst
Right.
dream
Right.
of everybody. It is a nightmare. So basically, the way here is to protect the system with the high security standard and be compliant
Right.
to the highest regulation, that is the GDPR, the other important certifications. And I see now with the new product that I'm following in Doctolib, that is Doctolib Siilo, that is the first instant messaging hub built for and created for healthcare professionals.
Sure.
That is the first tool used to sharing health data of patients in Italy. And I don't know how does it work in US. It is WhatsApp.
Right. Well, we definitely don't have a national platform that the broader healthcare market is leveraging to share patient data and for patients to have access to. So the fact that your platform, and I'd love for you to talk a little bit more about that as well, too, was that driven through your federal government to establish this technology? Was this a private sector company that built this that now has been established across the broader Italian healthcare ecosystem? How were you able to get one platform, one solution to now become the de facto standard for the Italian marketplace?
But actually, I think there are different ways. From one side, we have the general and national health electronic health records. That is one thing to record specifically patient data. From the other, it is when you share instant information, for example, to ask a second opinion related to a patient case to another professional. In that specific case, what we are trying to scale in Italy is a proper solution with the right certification and proper standards in terms of privacy to share this kind of information, because now the first tool used is WhatsApp and it's not good. It's not good for hundreds of reasons that can list to you. But I think it's clear why.
Exactly. That's great. Again, I think here in the US, we're definitely much more fragmented when it comes to leveraging these types of platforms for the exchange of patient information or collaboration between healthcare professionals. We don't have kind of one platform or one tool to do that. Even if it's one that you're still rolling out and emerging in the marketplace, we're very much a very fragmented system where you've got best of breed technologies that are competing against each other to perform these types of functions. And then we have multiple EHR vendors who have their proprietary platforms, and we're still challenged with the sharing of patient information amongst those platforms, or even within healthcare systems themselves being open and willing to make that data easily available. Although we have federal mandates that mandate that they have the ability to share it, we're still very slow in the adoption of that and making that a real reality. So it's interesting to see that there's a much more inclusiveness and approach by the broader healthcare system in Italy to do that. And I wonder if that's more because you guys have really government funded healthcare, correct me if I'm wrong, which I think makes it probably a little bit more easier to adopt technologies across a broader healthcare system versus here in the United States, which although we have government healthcare, VA, Medicare, Medicaid, we still very much are a private sector driven healthcare system as well,
Yeah.
which makes it a little more of a challenge.
Actually, I think that we are lucky from one side to have the national health system, but from the other, the bureaucracy make the innovation in the public sector very, very low.
Oh, that's
But
interesting.
at
Yeah,
least, as you mentioned, we have a solid base to work on that
exactly.
is across the nation.
Yeah, it sounds like a double-edged sword. You're able to adopt things broader across an ecosystem, but because of the bureaucratic nature of it, it takes longer for that adoption and innovation to happen. I'm curious what is happening there in Italy around things like virtual care, telemedicine. Are you seeing the adoption of that type of technology permeate within the European market as a whole, and then specifically within your region?
Yeah, absolutely. There are a lot of private providers. For example, also Doctolib, it is one of the two in this term, and there is a high adoption because after the pandemic period, it is a way to overcome the residential area and arrive to every patient in particular. And then I can mention to you, there are some specific regulations that comes out after the COVID pandemic to bring healthcare assistance across the patient. But in terms of teleconsultation, we have different providers, but also in this sense, the government is working on the national telemedicine, the official telemedicine platform.
Sure.
In order to provide this kind of service at national level, but also another time it is something like 2025, 2026, 2027. Exactly. I don't know. Every year.
It's pushed out.
Yeah. But we are still working on it. So we have a paper and regulation and documents. But so in theory, we are on it. In practice, there is a lot of stuff to do, but we are working on it.
No, that's great. One of the things that's also a big challenge here in the United States is this whole concept of health equity. We deal with things around quality care based on economic conditions, ethnic backgrounds, and what we call social determinants of health. Those things that have a direct impact on someone's health, whether it's access to quality food, education, transportation, a whole set of issues, not to mention racial disparities as well, too. I'm curious, in Italy, are you guys faced with similar challenges around health equity?
No, actually, we're luckier because for the nature of the national health system, we have the public sector that can be accessible with only the payment of a ticket, every type of procedure, even if we are the problem of waiting list and probably if you need a visit 3 months as a period prescribed by your doctor, maybe if you are lucky, you reach like the last closest deadline, and maybe you have to move across the region to find the hospitals have the place for it. But we have it, so we have it. So we have problem with waiting lists, but is one sense to have the problem of waiting times. But from the other, in your perspective, from your point of view, you don't have the opportunity also to wait for it.
Exactly. No, that's interesting. Yeah, I think here there's definite challenges around treating patients, again, based on their access to care, their cultural backgrounds, in some cases, the fear that some patients may have about the healthcare system because of some of the unfortunate atrocities that have happened to certain groups of people. And so we still have a ways to go to address those challenges and hold our healthcare providers accountable for delivering care equitably across the ecosystem. I think on your side, it sounds like sometimes it's the bureaucratic aspects of healthcare, having to wait to see a doctor, but not necessarily, I can't see a doctor because I'm of certain background or a certain culture or a certain group.
Yeah.
That's great. That's great. We need to
simply when the people have the possibilities, simply switch from public to private, and because they are willing to pay more for that
Sure.
specific service. But if someone don't have the willingness to pay more, simply
Right.
wait.
Right. So the disparities may be economic. And so if I have the resources and receive care faster, maybe out of the country or somewhere else, I use that as an option. But if I don't have those resources, then I have to deal with the existing system as it is. I care through that. So that makes sense. We're getting close to the end of our conversation, and I'm just curious from your perspective, if you could talk a little bit more about what you're doing at your company. And you talked about this technology, which sounds really interesting. If you would share a little bit more about that. And then for those individuals, young professionals like yourself, that are moving into this space around healthcare technology, any specific advice you would want to share with them? You've been obviously recognized for your leadership. Any specific advice you would want to share with them to help them navigate their careers as well, too?
Yeah. Thanks for the last question. Briefly, what we are trying to do with the product which I'm working on now, it is to provide the right secure tool to promote care cooperation. So providing a secure app with the specific functionalities for healthcare professionals, for example, having the opportunity to package, let me say, information related to a patient case in a specific conversation inside the other conversation that you can have. So me and you can have a conversation on also our schedule for tomorrow, appointment, and so on. And then we talk about a specific patient. In that specific case, we can create a specific conversation in a conversation that is related to a patient, and that this container is able to be searchable in the time. So you can also store it and download it, so you can collect information related to patient information, and also promote research, collaboration across professionals. So you are able to reach this directory of medical doctors that are certified, because people that are in the app need to be certified both as the identity and as the practice, the right to practice. So this is a high level of security, but also client to hold regulation and so on. Also having other specific functionalities are able to provide the best experience with the highest security standard to the specific sectors of healthcare.
No, that's wonderful. And that's exciting to see a technology like that and also be adopted across the broader healthcare ecosystem as well, too. We should take a page out of what you guys.
Yeah, it's born in Holland. And actually there we have already over the 90% of penetration inside the market.
Great.
And in particular, we have more than 900,000 of healthcare professionals there.
Wow.
And we are already in 19 countries in Europe.
Oh, wow. That's amazing. You hear that?
And, our big challenge is to also have Italy to use it broadly.
Exactly. And you're dealing with not only the different cultures and languages and nomenclatures within Italy, but across the European Union as well, too. So that's amazing that this technology is being adopted not only there, but across the European Union as a whole. So final thoughts, any words of wisdom, any thoughts you want to share with, again, individuals that are pursuing careers in the healthcare ecosystem? And I'm going to add one other question. What advice would you give us here in the U.S. on how we should improve our healthcare system as well?
Wow. For the last one, I don't know if I have the answer. Actually, you should give me the answer after having a look on Europe.
Sure.
So related to final thoughts, what I can say is not applicable only to a healthcare sector, actually to every sector. For everyone specifically has his own story and his own challenges and the complexity in the sector that decide to invest or spend some years of their career. But for me, what was key and will be key always in the next years is to find your why, find your purpose, understand deeply who you are, who you want to be, connecting the dots of your personal journey, and then connect with other that build deeply connection with others that you think are similar to you.
Exactly.
And I think
That's
this
good.
is
Great advice as well. And then any thoughts about the U.S. healthcare market? Any suggestions for us?
oh wow, big responsibility. So you have many more, maybe not for sure of Italy. You have many more technologies already, because from your side is faster to bring innovation in the system and also having instant benefits from it. But from the other is something that should be changed at government level. So in order to actually giving truly to citizens, to American citizens, the opportunity to access to and manage their health,
Exactly.
there should be create a very solid system, found system that can financiate in such a way or co-financiate the bills of healthcare.
No, sounds great. Well, I'm going to leave it at that. And again, thank you, Giorgia, for taking time out of your busy schedule to participate as a guest here on Straight Outta Health IT. If someone wanted to reach you and find out more about you and what you're doing and the technologies that our European Union and specifically the folks in Italy are leveraging, how would they connect with you?
You can attach my LinkedIn profile to the podcast, and then feel free to reach me out on LinkedIn. I am a very big lover of sharing news, latest news of innovation applied to the sector. So if you want to join me in your network, I will be happy to do the same.
Well, wonderful. That's it. We'll leave it at that. Thank you, everyone, again, for taking time out of your busy schedule to learn more about what's happening in the European healthcare technology ecosystem, and again, more specifically in what's happening in Italy. And thank you, Giorgia, for taking time out your schedule to chat with us and share your thoughts and insights on this as well. So that's it, everyone.
Thank you.
Yes, you're welcome.
Thank you very much.
You're very welcome. Thank you. And that's it, everyone. Until next time, I'll see you on the next episode of Straight Outta Health IT. As always, your feedback and comments are welcomed and encouraged. And if you like this episode, please share it with more than one friend. Let's make Giorgia's episode go viral, not only here in the US, but all over the world.
Oh, thank you.
You're very welcome. Thank you very much. Have a great day, and God bless everyone.
Thank you so much for listening to Straight Outta Health IT. We hope you enjoyed today's guest. For more unfiltered dialogue of healthcare leaders and influencers, be sure to tune in next week. For the show notes, transcripts, and resources, please visit Apple Podcasts, Spotify, or your favorite streaming platform. We invite you to give us feedback by reaching out to Christopher Kunney on LinkedIn, just searching for Straight Outta Health IT, and you'll find us. We are constantly having live discussions about diverse topics in the industry.